Hello and welcome everyone to our latest presentation on convalescent plasma in COVID-19 patients, a randomized control trial. This study was published in JAMA last week from China. So the research question was, what is the effect of convalescent plasma therapy added to standard therapy compared to the standard therapy alone on clinical outcomes in patients with severe or life-threatening COVID-19 infection? The inclusion criteria were age 18 years or more, patient who is positive for COVID-19 with PCR, pneumonia on chest X-ray, and clinical symptoms meeting the definition of severe or life-threatening COVID-19. So what are the definitions of severe and life-threatening? Severe COVID-19 is defined as respiratory distress more than 30 breaths per minute or saturation less than 93% in room air or a PF ratio less than 300. Life-threatening COVID-19 was respiratory failure requiring mechanical ventilation, shock, or any other organ failure requiring an ICU admission. The exclusion criteria were severe septic shock, PF ratio less than 100, detection of high titers of S protein RBD specific, that is receptor binding domain specific, patients with pregnancy, participation in other trials, or congestive cardiac failure. Procurement of convalescent plasma. So the convalescent plasma was procured from patients who are 18 through 55 years, COVID-19, but with two negative PCR results from nasopharynx at least 24 hours apart, and discharged with more than 2 weeks from hospital and with no persistence of COVID-19 symptoms. The specific antibody to the receptor was measured and reported from dilution of 160 to 1280. A neutralization titer of 1 is to 80 was equivalent to 1 is to 1280 of the specific antibody. And to ensure the potency, a titer of at least 1 in 640 was used. How was the convalescent plasma transfused? Approximately a dose of 4 to 13 ml per kg of recipient body weight was used, and after the initial infusion of 10 ml, the infusion rate was increased to approximately 100 ml per hour. No premedication was used during the transfusion. So out of 148 patients who were assessed, 103 were randomized, 52 to the convalescent plasma group and 51 to the standard group. In convalescent plasma group, one patient discontinued treatment and one patient in the standard group received convalescent plasma. They were excluded in per protocol analysis. The primary outcome was percentage of patients who showed clinical recovery at day 28. In the control group, it was 43.1%, while in the convalescent plasma group, it was 51.9%. It was not statistically significant. So what was the author's conclusion based on these findings? So they concluded that among the patients with severe or life-threatening COVID-19 infection, convalescent plasma against a standard treatment alone did not significantly improve the time to clinical improvement within 28 days. So what are the limitations of this study? It has a very small sample size, and the median time from onset of symptoms to randomization for receiving the therapy is as long as 30 days, which is a long period of time. It is an open label study, so can have bias. The standard care is not protocolized. So we cannot say the patient receives equal care in both the groups. 28 days is a very short follow period in this particular study, and CRP was significantly more in patients who received convalescent plasma. In patients who had severe disease, we can see here that the convalescent plasma shows better recovery than in patients who received standard treatment. Mortality was also less in patients who were receiving convalescent plasma, and viral clearance was significantly better at 72 hours in patients who received convalescent plasma. So what is our take? Our take is that follow-up was very short and time to receiving the treatment was 30 days, which was very long. Improved outcomes were still seen in patients of severe group. So convalescent plasma may be used in this particular group of patients with a longer follow-up period time to check for the benefits of this particular therapy. So thank you for your patience and check our website for further information.